Some parents in the Virgin Islands have been accused of neglecting their responsibility to discuss matters about sexuality with their children to help prevent them from contracting incurable diseases and other negative impacts. This observation was made on a recent JTV Spotlight program by Jason Rubain, a volunteer with the National HIV/AIDS and Sexual Health Program.
It seems as though parents have, to a certain degree, neglected their responsibility for being the first point of contact with their children. And they have a philosophy or a belief or probably even a practice where they believe that the government is supposed to solve everything. Okay? And they have this perception that as far as the school is concerned, the school is supposed to teach my child this. And the government is supposed to provide this. And this agency is supposed to do this, and that agency is supposed to do that. But as a parent, they're not doing what they are supposed to be doing. And I have realized that until we can get back to holding parents accountable for being that first point of contact, that first point of reference for their children, that we'll continue to experience some of the things that we're experiencing.
As coordinator of the HIV/AIDS and Sexual Health Program, Noeline Levens-Clark explains that much of the unhealthy social behaviors displayed by young people in the Virgin Islands are a reflection of the behaviors and lack of trust for adults around them.
I think it needs to be an inter-sectoral partnership. Social development, Sandy Lane Center, we do have a high percentage of young people now on drugs, being admitted to the Sandy Lane Center, Family Support Network. I mean, the whole society needs to come together like before and work together, not just addressing youth issues, but even adult issues, because a lot of our young people are feeling so in despair because of what they're seeing going on among the adults in their lives. There's no good role model, really. I mean, who do I go to if I have a challenge, if I have a problem? Who can speak to me in a way that I can understand and I can relate to? Where do I go when I really need help?
In 2015, the HIV/AIDS and Sexual Health Program will seek to transition into family health and coordinate the BVI family health strategy, strategically create an enabling environment to address teenage pregnancy, and to work with the Attorney General Chambers and the health sector to synchronize the age of consent with the age of access to health services. Marriage and family therapist Dr. Cindy George is president and CEO of the Samorj Foundation. She says much of the problems are rooted in a limited understanding of what teens and young adults experience in their everyday lives.
The home environment. We may be needing more parental guidance, we needing more parental connection, communication, that personal connecting to parents. On a social level, we may be missing friendships, we may be missing trust, things like that. And then on a broader community level, we may be missing acceptance, acknowledgement of what we really want. Okay, and what I'm getting at is that we have to understand as a child and adolescent develops, they are moving from a place where they don't know who they are to a place where they're trying to understand who they are and to a place where they want to be who they are, if that makes sense. Okay? And so we need to, as a community, understand that and to say, okay, well, how can we then begin to assist? And I think a lot of the, I hate to use the word problem, but a lot of the problem comes from when we don't understand that process. And we don't understand, okay, as a teenager, those links are not connecting. There may be something on the home front. Parental relationships aren't connecting. Sibling relationships aren't connecting. That sense of individuality, who they want to express themselves, who they want to be, may not be what our society deems as normal or as acceptable. And so we have a lot of, think about it as within turmoil, and inter-turmoil with the persons in our lives, in our relationships. And so if we think about it like that and we kind of see, well, what's really happening on those ends, we can get some of the answers and some of the solutions and to see how we can better help them.
The National HIV/AIDS and Sexual Health Program, or NAP, has engaged Samorj Foundation in a private-public partnership to realize various aspects of its 2005 HIV/AIDS and Sexual Health Program's work plan. The National AIDS Program will host its 5th annual award ceremony on World AIDS Day on Monday, December 1st, 2014. The event is held to show appreciation to volunteers, community partners, and corporate support for the program.